Happy week between Christmas and New Year. We get pretty busy in the practice here with surgery, but I had a slow afternoon today, so I thought I'd take this opportunity to talk to you about a case that I recently saw come back, a woman who had surgery with me a few months ago and really loved her result. So we are going to talk about Browlift and Blepharoplasty.
This 55-year-old woman had concerns about how her eyes looked and how her brows made her eyes look very heavy and tired. She had bags underneath her eyes and a lot of heaviness in the upper eyelids. An upper blepharoplasty alone would not have been sufficient to unweight these eyes. So I recommended we do an upper and lower blepharoplasty and an endoscopic style brow lift. The result is clearly beautiful. The asymmetry in her eyebrows is much improved. Her heaviness of the upper eyelids is gone, and the lower eyelid bags are much improved. I also did a medium chemical peel called a Jessner's TCA 30% peel. And this was to try to smoothen the wrinkling that I knew would happen once this extra fat was moved or removed. And unfortunately, that peel didn't quite improve the wrinkling enough. And so she's going to be coming back for a complementary, deeper chemical peel that will help smoothen her skin further. Despite the wrinkling, she is doing great. She really loves how her eyes are open. When she smiles, she looks much more bright-eyed, and she has a much prettier smile, just as a result of surgery. When we look at her oblique view, she has similar improvements as we saw in the front view. Really pretty transition between cheek and eyelid here, and a beautiful shape to her eyebrow and upper eyelid complex. Her left side is similarly improved, if not more so. This heaviness is much better than it was. You can see her eye, and you can see how pretty her lower lid transition looks. Even with the extra little wrinkling that she has, this looks much more rested than that. Close-up views are really helpful to look carefully at some of the improvements that we've made. So I want you to notice that the lower eyelid position is essentially the same as it was preoperatively, if not improved even slightly a little bit. The distance between the lower eyelid lash line and the lower eyelid cheek hollow is much shorter than it was. This distance is much longer than this distance, which has been shortened by surgery. This is a lower blepharoplasty I perform by going through the inside of the eyelid typically, because most patients, including her, don't have extra skin. This wrinkling isn't because of extra skin, it's because of skin that was pushed out and now has fallen back and is wrinkly. So removing skin in this case would have weakened her eyelid and potentially created a pull down or malposition that we want to avoid at all costs. So the operation, we make an incision on the inside of the lower lid, come down to the fat, and release the ligament that creates this hollow or tear trough between the fat and the cheek. By releasing the orbital septum at its insertion on the bone, we get improved elevation and transition of the midface. In some patients, we can even dissect down and release the midface and lift it to fill this void that will be left behind once we remove some of this fat. Many surgeons reposition fat. They take the fat and move it so that it fills this area. I don't understand that. I think it's much easier to do what's natural and to try to replicate what's happened with aging, and that is release the ligament and allow the cheek fat to fall into this void, or lift the cheek fat with a little suture so that we're getting a cheek lift at the same time as unweighting the lower eyelid and creating better support to the lower eyelid. This is sharp. This is in sharp contrast to incisions along the skin of the lower eyelid, which weaken it, and then the healing forces tend to pull the eyelid down and don't allow the eyelid to heal upward in a very natural, more youthful way. When the patient looks upwards at the camera, it highlights how much fat excess there was. It highlights that sharp shadowing between the fat and the cheek, and it highlights how long the eyelid looks. In this case, all that is improved. The length of the eyelid goes from this length to this length, which is a beautiful short eyelid, more youthful looking eyelid. Same thing on the other side where the fat was even more prominent. And then cheek is released and lifted so that the hollowing is improved from that tear trough area. She looks great. She feels much prettier. And this is a safe operation that's left her feeling and looking just great. Thank you everyone for listening today, and I hope to talk to you again soon.